Speaker, my question is to the Minister for Health and Wellbeing. Can the Minister give my community confidence as to the future of Hammill House in Port Pirie? And with your leave and that of the House, sir, I'll explain further.
Leave is sought. Is leave granted?
Yes, sir. Thank you very much. There was an announcement by yourself, by the Minister, over 12 months ago that this facility will be retained. In response to my question on the 24th of November last year, it was stated that the government was committed to increasing the capacity to 18 residents. However, at the current number, there is only 10. The uncertainty shown by the local health board is raising grave concerns for those families of the residents, also by the residents themselves, and also of all the staff for the continuation and security of their employment and also the residents there.
The Minister for Health.
Thank you very much, sir, and I thank the member for his question and note his very, very strong advocacy on behalf of Hammill House and his community's access to aged care services. For people not aware, Hammill House is a facility adjacent to the Port Pirie Regional Health Service. It's a service in which about a year ago or so there was a consultation undertaken by the York and Northern Local Health Network in terms of the future of Hammill House. Bearing in mind a number of private facilities in the Port Pirie region. And the result of that consultation, with particularly strong advocacy from the member himself, was to retain Hammill House. And that has been confirmed by myself, by the York and Northern Local Health Network. The challenge has been to increase the numbers. We need to increase the staffing, very similar to debate we were having this morning in terms of nursing across the board. And it's been an area in which we have had challenges in terms of being able to recruit staff into Hammill House. It's been something that I've been raising very regularly with the York and Northern Local Health Network to pull out every stop to make sure that we can address the staffing issues that have been very long-term there in Hammill House. And they have been actively working to recruit roles. In positive news, I can report that York and Northern Local Health Network have been able to recruit an Associate Nurse Unit Manager who commenced in 2025 and have recently recruited an additional Associate Nurse Unit Manager who's set to commence next month. So that's very good news to have those leadership positions there in Hammill House, which are critical in terms of our ability to attract other nurses into that service. As we were also talking about earlier today, in terms of what happened with Whyalla birthing services, that was critical to turning that around as well. Getting the leadership, strong nursing leadership in place, strong midwifery in that case, leadership in place, was critical to be able to attract other midwives to want to work there, and I'm confident the same will be the case in terms of Hammill House as well. So they've also been able to recruit a temporary nurse unit manager from an agency who commenced recently on a short-term contract, and that person, importantly, is very experienced in aged care and has been providing strong leadership for Hammill House staff, including identifying opportunities for improved services to be provided. But there's still obviously more work to do in terms of the recruitment of staff, but I think that is a good first step to be able to address those issues. And they are still actively recruiting for additional staff there. I'm advised by York and Northern there's currently one person on the waiting list as of the 8th of September this year, and no consumer inpatients who are in the Port Pirie Hospital seeking a permanent residential aged care place in Hammill House. So that's also positive news. So where a patient's care and placement into aged care is a pressing necessity, York and Northern regularly works to support access to aged care facility in a location as close as possible to that person's desired location. They've been meeting regularly with the other providers in Port Pirie to facilitate communication and collaboration of all of those services. And it's worth noting that those other facilities have unopened beds as well. That obviously over time we would like to see them being able to open as they address their own workforce issues. All of this highlights another key measure that the member himself has been a strong advocate for, which is we need to improve our pipeline of training locally in Port Pirie. And I'm really delighted that we're pushing ahead with the plans to establish the simulator, or what's going to be a real training academy based in Port Pirie, which will enable universities, whether it's a uni hub or other universities, to be able to do that clinical simulation based in Port Pirie, which is going to be critical for training that workforce locally.